Hello, everyone. Welcome to the information session for the online graduate certificate program in Health Terminology Standards offered by the School of Health Information Science at the University of Victoria. My name is Francis Lau, and I'm the faculty coordinator for this program. Before I begin, I want to acknowledge and respect the Algonquin peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanish peoples whose historical relationship with the land continue to this day. In the next 20 minutes or so, I'm going to provide some information about the certificate program and on how it can help advance your career. Then Helen Beaumont, the Manager of Academic Relations from the Canadian Health Information Management Association, is going to share with you her thoughts about why this program is important for you to consider. Please also note that we will be recording the presentation portion of this session. And during the session, if you have any questions, please type them in the chat box or just raise your hands and we'll be glad to address them at any time. As you can see on this slide, which is kind of busy, the certificate program has 4 graduate level courses that you can complete part-time in 1 year while you work. The courses are all done online in real-time, weekly evening classes from 5 to 7 p.m. Pacific time. There's also a 2.5-day workshop, virtual workshop done in the 3rd week of May. Many of the classes in the 2.5-day workshop are jointly delivered with our partners, Jevity, which is now Accenture, RKL Informatics, and Ontario Health Digital Health Standards team, which are all industry leaders in health information standards in Canada. Now, the first course is Health Information Science, or HINT 535, Health Information Standards, done over 13 weeks, starting in September. This course introduces you to different types of terminology standards for capturing clinical events, such as diagnoses, findings, assessments, and medications, as well as data exchange standards for sharing patient information through electronic messages and documents. There will also be hands-on learning activities and term papers, so you can apply the concepts learned through case studies. The second course, HINT 536, is on controlled terminology standards, also done over 13 weeks starting in January. This is where you will learn more about specific terminologies, such as SNOMED-CT, which is a reference terminology for diagnoses, clinical findings, body sites and organisms, etc. You will learn how to use these terminologies, such as creating subsets, extensions, and cross-maps, and also querying patient records. You also learn about how to implement and support these terminologies in health organizations. The third course is 537, or Health Information Exchange. It is done in a compressed format over 6 weeks. In addition to weekly online classes, there's a 2.5-day intensive workshop, virtual workshop in the 3rd week of May. The course will introduce you to real-life standards-based healthcare applications and case studies for such areas as immunizations, medications, imaging, lab systems, and clinical reporting. The emphasis is on the appropriate use of terminology standards in these healthcare applications. The final course is HINT 597, which is a capstone or field project done in 3 months from June to August. This is where you will apply what you have learned in the previous 3 courses to work on a practical terminology-related project. So here are some examples of the field projects we'll show you. These, the topic for these projects typically is framed around a standards lifecycle stage, which covers needs identification, specification, development, deployment, and maintenance of a particular standard application. Some of the example projects are, here you see, identify requirements for a specific terminology for use in a health organization, or it is to develop a business case for a specific terminology for a health organization, or it is to analyze local clinical terms, coverage and usage in an e-health system. So these are around more the needs part of the life cycle stages. Then the next would be to analyze and evaluate the control terminology governance options and develop recommendations. or it is to analyze terminology specifications for specific health information exchange standards being developed, or it is to develop some specifications for a structured data entry retrieval template. So those are more around the getting into specifications for the standards. Next, we have mapping local drug terms to, let's say, for the Canadian Clinical Drug Database, which is one of the drug terminologies used in Canada, or to create a specific SNOMED CT subset for a health organization, or it is to create a SNOMED CT education program for a health organization. So with these projects, they tend to focus around the development of some of these standards-based terminologies and applications. Next, you have examples of creating an implementation plan for a specific terminology in health organization, or to develop a user engagement strategy for an organization to adopt HIE standards. So those are around sort of development deployment. Finally, we have examples of to develop an HIE maintenance plan for an organization with a focus on terminologies, or to evaluate the quality and use of a specific SNOMED CT subset for health region, or to evaluate impact of a specific terminology subset on quality of care. Now, again, these are just as examples of the projects. And if you happen to be working in the health organization, we actually encourage you to find a project that may be of immediate use and benefit to your own organization or to your own learning, so that every bit that you learn from the program can be applied immediately and put to use to benefit yourself or the organization. So you may ask, how would the program help with my career? So the profiles of the graduates of this program can be found on a school website. Typically, they include nurses, doctors, information technology or information management analysts, or project managers who want to learn more about health terminology standards. And upon completion of this program, you will be eligible for the credential of Certified Terminology Standard Specialist, or CTSS, from the Canadian College of Health Information Management, which Helen will talk about shortly. With the knowledge gained from this certificate, you can work on all kinds of terminology standards, health information exchange, and interoperable electronic health record related projects. And in fact, often you will become the go-to person within your organization for projects that involve the use of health terminology in data exchange projects. So at this point, I'm going to turn the microphone over to Helen, who's going to speak to you a little bit about the college and the CTSS. Helen, take it away.
Thank you very much. It's great to be here. I'm going to touch on first the accreditation process as well as certification, and then our CPE program. So the Canadian College of Health Information Management is the certifying body for health information management, or HIM professionals. Candidates who successfully complete a terminology standards program accredited by the Canadian College of Health Information Management may be eligible to receive a CTSS professional designation. Now, certified terminology standards specialists enable effective communication in healthcare and provide consistency to a fast-paced and evolving industry. The requirements for upholding and maintaining this professional designation are as follows. 1, annual membership renewal with the Canadian Health Information Management Association, or CHIMA. 2, upholding of the Professional Code of Ethics. And 3, completion of the required continuing professional education, or CPE credits, as per the timeframe set forth in our CPE policy. I invite everybody with questions on the Code of Ethics or our CPE policy to review the college website at cchim.ca. And any questions about CHIMA can be found on the chima.ca website as well. If you want to just quickly move over to the next slide. Thank you. Certified health information professionals are equipped to ensure an organization is well prepared to handle Canada's most sensitive and intimate data. Certification reduces organizational risk by ensuring oversight by the Canadian College of Health Information Management and ensures continuous learning and ongoing education by certified professionals. I'll pass it back over to Dr. Lau, and if anybody has any questions for me regarding certification, the NCE, or anything related to CHIMA, you're more than welcome to reach out to me directly.
Thank you so much, Helen. So next, I'm just going to show you where you can get more information. And here's the school website with the link here that you can find additional information on how to apply to this certificate program requirements, insight from some of the industry leaders and experts, and profiles of some of the certificate alumni. And you'll find all kinds of information on this website. And there's also a video that gives you a little bit of a short clip about the this particular program. And there's also additional information about the application deadline, which is June 1st, 2022 for the September entry. So it's a few months away. And you can find contact for myself here with email and also Sandra Bowen. Sandra, would you like to introduce yourself at this point?
Hello, everyone. Nice to see everybody here. I'm sort of your contact with the school if you have questions about how to apply or about the program. And if I can't answer them, I definitely will find someone that can and forward your email. But the application deadline is June 1st for September entry. But if you're going to apply, I encourage you to start the application process early because there are documents that you'll need to upload, and also you'll need to have references for your application. That takes time for them to submit the referee report to the application system. So any questions that you have, please reach out to me. My email is there, but it sure is nice to see all of you today.
Thank you, Sandra. There's also information about the school website, and as you can see from the slide previously, this is the link to that particular website where you can find program overview, admission requirements, etc., and how to apply. And there's also the tuition fee information as well. And here's the CCHIM, which is the Canadian College of Health Information Management website that Helen was referring to, which also has the URL over here. So please note that we have a repeat session, which is going to go through the same information again on March 23rd at 9 a.m. Pacific time or 12 p.m. Eastern time. So in case you have questions and you want to come back to listen to it again, you're welcome to do so. Or if you can tell some of the colleagues who are not able to attend today's session to join this session, you're welcome to do that. And of course, today's session will be recorded as well. So
Francis, may we also mention that we will be having an alumni of the certificate program at that session. So it's excellent to hear from an actual student who has completed the program.
Thank you for reminding me about that. Yes, indeed, as Sandra said, next time we're going to have an alumni to speak to you about personal experience with this program as well. So this concludes sort of the more formal presentation portion of the session. So now we're going to turn off the recording and we're going to turn the attention to you to allow you an opportunity to make some comments, raise questions, etc.